The regret of nursing home placement, 6 critical considerations for prospective residents. Imagine dedicating your life to hard work and family, only to end your days in a cramped room, far from loved ones. I once believed that nursing homes offered safety and comfort, however, the reality fell far short of expectations. This video will reveal 6 harsh truths about nursing home life that are rarely discussed. If you are considering a nursing home for yourself or a loved one, watch this video to avoid the mistakes I made. 1. The loss of independence. Prior to residing in a nursing home, residents enjoy complete autonomy. At home, individuals retain absolute control over all aspects of their lives, from sleep schedules and dietary choices to daily activities and personal preferences such as reading or relaxing in their preferred seating. Personal routines are fully preserved. Residents prepare their meals, pursue leisure activities, and engage in any pursuits aligning with their individual lifestyles and preferences. Upon admittance to the nursing home, a rigid schedule was imposed, dictating every aspect of his daily life. Mealtimes were rigidly enforced. Regardless of hunger, he was compelled to eat at predetermined hours. Lights out was similarly inflexible, eliminating any autonomy over sleep patterns. Even the simple act of taking a stroll required prior authorization, transforming a previously effortless activity into a bureaucratic process dependent on staff availability. Personal agency was systematically eroded. Choices as fundamental as selecting clothing or preferred meals were no longer his prerogative, but rather dictated by external forces. This pervasive control fostered a profound sense of disempowerment, a stark contrast to the independent life he had previously enjoyed. The experience was not one of care, but rather of enforced conformity, stripping him of his autonomy and reducing him to a passive recipient of institutional dictates. This loss of control significantly impacted his well-being and sense of self-worth. The psychological impact manifested in a profound sense of disorientation. During the initial week, he awoke to the stark realization that he was no longer in his familiar home. His accustomed surroundings had vanished, replaced by an alien and unsettling environment. This disorientation was compounded by a gradual increase in passivity. Initially, he resisted the rigid regulations imposed upon him, but his opposition eventually waned as he confronted the inescapable reality of his inability to alter the system. This enforced conformity led to a profound sense of self-loss. Stripped of autonomy and self-determination, he experienced a disintegration of his personal identity. The enforced adaptation to a pre-existing system resulted in the erosion of his individuality and the suppression of his inherent self-sufficiency. This loss of agency was a significant contributor to his overall psychological distress, highlighting the detrimental effects of systemic control on individual autonomy and self-perception. 2. The experience of being overlooked. Prior to his admission to the nursing home, the subject enjoyed a robust and consistent network of familial connections. Regular visits from grandchildren and children provided opportunities for meaningful conversation and the sharing of daily life experiences. These interactions, encompassing phone calls, family meals, and gatherings, fostered a strong sense of belonging, care, and affection, effectively mitigating feelings of isolation and loneliness. Furthermore, he maintained a sense of self-worth and purpose through active participation in family life. He continued to offer assistance to his descendants, sharing his extensive life experience and providing valuable counsel in family decision-making processes. His social life remained vibrant, encompassing regular interactions with friends and neighbors, and participation in community activities, thereby reinforcing his sense of identity and social integration. This established pattern of social engagement and familial support significantly contributed to his overall well-being and quality of life before institutionalization. Following admission to the nursing home, the frequency of visits diminished significantly. Initially, family members were frequent visitors. However, the number of visits gradually decreased, often limited to special occasions such as holidays. Phone calls became less frequent, sometimes reduced to mere perfunctory exchanges. A profound sense of abandonment emerged. Prior to his admission, he felt integral to his family's life. Within the nursing home, however, he recognized that his grandchildren's and children's lives continued unimpeded by his absence. Updates on family matters became infrequent, exacerbating his feelings of isolation and detachment. Loneliness intensified over time. Despite residing in a community of elderly individuals, each resident harbored their own private sorrows, incapable of supplanting the irreplaceable comfort of family. Conversations within the nursing home frequently revolved around melancholic themes, illness, mortality, and reminiscences of the past, rather than optimistic discussions of the future. This stark contrast between his previous life and his current reality served to highlight the significant emotional toll of his isolation. The lack of consistent engagement from his family underscored a palpable sense of neglect, further compounding his feelings of abandonment and accelerating his descent into profound loneliness. The absence of meaningful interaction contributed to a decline in his overall well-being, highlighting the critical need for consistent family support and engagement in the lives of elderly individuals residing in long-term care facilities. The psychological impact manifested as profound sadness and a debilitating loss of motivation. Initially, he eagerly anticipated visits from his children and grandchildren. However, the absence of these anticipated visits resulted in escalating disappointment and a significant erosion of his faith and familial connection. This profound sense of abandonment led to increased social withdrawal and a marked decline in engagement with his surroundings. His previously vibrant spirit was replaced by a pervasive negativity, characterized by recurring thoughts of uselessness and a conviction that he had become inconsequential to his family. This experience, unfortunately, mirrors the common psychological struggles faced by many elderly residents in long-term care facilities, frequently culminating in clinical depression or pronounced social isolation. The regret associated with his decision to enter the facility became increasingly acute. He now recognizes that, had he foreseen the depth of his emotional isolation, he would have actively pursued alternative strategies to maintain stronger familial bonds, foregoing institutionalization altogether. This underscores the critical need for comprehensive support systems and proactive measures to mitigate the psychological risks inherent in long-term care environments. Maintaining contact with loved ones is more crucial than often realized. A brief phone call can significantly enhance the well-being and sense of belonging in elderly individuals. Families should proactively maintain consistent communication, rather than limiting contact to special occasions. Prepare for the transition to a nursing home. Do not expect the same frequency of visits from family as before. Embrace change and cultivate joy from simple pleasures. Develop new social connections, rather than solely relying on family. The elderly should actively participate in nursing home activities to foster relationships with peers. Continue pursuing personal interests such as reading, journaling, or joining social groups to mitigate feelings of isolation. 3. Loss of life's purpose. A significant hardship experienced in nursing homes is not merely loneliness or feelings of abandonment, but also the loss of life purpose. The absence of goals and motivation renders life meaningless and void. Before entering a nursing home, the elderly typically possess compelling reasons for continuing their daily routines and striving forward. Family serves as the most significant motivating factor. They actively participate in childcare, mentor younger generations, and impart valuable life experiences. Assisting grandchildren, even through seemingly minor tasks such as school transportation or preparing family meals, reinforces their sense of purpose and value. Continued professional engagement and societal contributions remain vital. Many retirees actively participate in community activities, senior clubs, or volunteer work. They offer guidance and support to friends and neighbors, making crucial life decisions, thereby maintaining a sense of personal relevance. Individual passions and hobbies, such as gardening, pet ownership, reading, writing, or painting, enrich their lives with joy and meaning. The transition to a nursing home often precipitates a profound loss of purpose and meaning in life. The individual's established role within the family structure is irrevocably altered. They observe family life continuing without their active participation, unable to directly mentor grandchildren or contribute meaningfully to their children's significant decisions. This exclusion fosters a sense of burden, replacing their previous valued contributions with feelings of insignificance and superfluity. The absence of domestic responsibilities further exacerbates this decline. At home, they engaged in tasks such as cleaning, cooking, and providing assistance. However, within the institutional setting, these duties are assumed by trained personnel. This lack of defined roles contributes to feelings of uselessness and redundancy, intensifying the sense of displacement. The monotonous routine inherent in institutionalized living significantly impacts the individual's psychological well-being. Days unfold in a predictable cycle of eating, sleeping, limited recreation, and passive entertainment. The absence of challenges and novel goals diminishes motivation and fosters a sense of stagnation. Life becomes characterized by boredom, emptiness, and a profound lack of anticipation. This predictable and unfulfilling routine directly contributes to the development of negative thought patterns. Deprived of a sense of purpose, residents are highly susceptible to depression and feelings of hopelessness. The prospect of death may become a more appealing alternative to enduring a life devoid of meaning. This can manifest as a reluctance to pursue medical treatment, as the perceived benefits of extending life are overshadowed by the overwhelming sense of futility. The inherent challenges of adjusting to life in a nursing home are compounded by the significant loss of personal agency and the erosion of self-worth, leading to a potentially debilitating decline in mental and emotional health. Maintaining a sense of purpose in a nursing home, a practical guide sustaining familial connections, is paramount. Regular phone calls, visits, and shared life experiences affirm the residents' continued importance within the family structure. Actively involving them in family decisions, even minor ones, fosters a sense of belonging and valued contribution. The pursuit of new objectives is crucial in combating feelings of purposelessness. Rather than succumbing to a sense of diminished expectation, residents should establish attainable goals. This could involve acquiring new skills, such as painting, journaling, or learning a musical instrument, or contributing to the community within the nursing home by sharing experiences and offering encouragement to fellow residents. Participation in group activities and clubs further enhances social interaction and provides a sense of purpose. The continuation of personal hobbies and interests is strongly encouraged. Existing passions, such as reading, gardening, or writing, should be nurtured and expanded upon. Journaling life experiences, for instance, can provide a valuable legacy for future generations. Cultivating an optimistic outlook is essential. While accepting the realities of aging is necessary, it should not define one's identity. Focusing on positive aspects of life, rather than dwelling on losses, is a proactive approach to maintaining well-being. It is imperative to understand that the meaning of life is not dictated by location but by one's perspective and engagement with the world. A proactive and positive attitude is the cornerstone of a fulfilling life, regardless of circumstances. 4. Health deterioration is exceeding projected timelines. A primary concern for the elderly residing in nursing homes is the accelerated decline in health. This can stem from various factors, including changes in living environment, care regimens, negative psychological states, and a lack of physical activity. Several factors contribute to the rapid decline in health among the elderly in nursing homes. Firstly, abrupt environmental changes disrupt established routines and social support networks. The unfamiliar surroundings, lack of familiar caregivers, and altered schedules induce stress, weakening the immune system and negatively impacting overall health. Secondly, emotional distress significantly impacts physical well-being. Loneliness, depression, and a sense of purposelessness compromise the immune system, increase blood pressure, and elevate the risk of cardiovascular disease, diabetes, and depression. Negative psychological states accelerate aging and worsen existing health conditions. Thirdly, reduced physical activity contributes to muscle weakness, bone fragility, and increased risks of obesity and diabetes. The limited opportunities for movement in nursing homes contrast sharply with the greater mobility often experienced at home. Fourthly, dietary changes can lead to malnutrition. The standardized menus in nursing homes may not cater to individual preferences or dietary needs, resulting in decreased food intake and nutritional deficiencies. Finally, while nursing homes provide medical care, the level of personalized attention may not match that of family care. This lack of individualized attention can lead to delayed diagnosis and treatment of health issues, accelerating health deterioration. The detrimental consequences of rapid health decline in the elderly. Diminished lifespan. Numerous studies demonstrate a statistically significant reduction in lifespan among elderly individuals residing in nursing homes compared to those living within a familiar family environment. This disparity is primarily attributed to a confluence of factors, including pervasive negative psychological states, insufficient physical activity, and inadequate psychosocial support. The absence of meaningful social interaction and a sense of belonging significantly contributes to accelerated decline. Increased morbidity. A precipitous decline in physical health renders the elderly significantly more vulnerable to a wide array of chronic diseases. These include, but are not limited to, hypertension, cardiovascular disease, diabetes mellitus, osteoporosis, Alzheimer's disease, dementia, and a compromised immune system, leading to increased susceptibility to pneumonia and other infections. The cumulative effect of these conditions often results in a debilitating cycle of illness and decreased quality of life. Heightened risk of depression. The progressive and often irreversible nature of age-related physical decline can engender feelings of hopelessness and despair. This profound sense of helplessness, coupled with the loss of independence and social engagement, significantly increases the risk of developing major depressive disorder. Untreated depression further exacerbates the physical decline, creating a vicious cycle that accelerates the deterioration of both mental and physical well-being, ultimately impacting lifespan and overall quality of life. Early intervention and comprehensive care are crucial in mitigating these risks and improving the overall prognosis for elderly individuals experiencing rapid health decline. maintaining optimal health in senior care facilities, a comprehensive approach sustaining strong family connections, regular visits and consistent communication from family members are crucial for the emotional well-being of residents. Scheduled visits should be supplemented by frequent phone calls and video chats to ensure a sense of belonging and connection. Opportunities for temporary stays at family homes, particularly during holidays and significant events, should be actively facilitated whenever feasible. Promoting physical activity and cognitive stimulation, senior care facilities must implement structured programs designed to encourage regular physical activity. These programs should incorporate a range of activities tailored to varying levels of physical capability, including gentle exercises, yoga, and supervised walks. Furthermore, residents should be encouraged to engage in light, meaningful tasks such as gardening, pet care, or mentally stimulating games like chess or puzzles to maintain cognitive sharpness and prevent decline. Prioritizing nutritional well-being, a diverse and balanced dietary plan is paramount. Meal plans must be individualized to accommodate specific dietary needs, preferences, and any existing health conditions. Regular monitoring of food intake is essential, and proactive measures, such as incorporating favorite dishes and offering easily digestible options, should be implemented to address any nutritional deficiencies or loss of appetite. Cultivating a positive and stimulating living environment, the creation of a vibrant and engaging atmosphere is critical. Facilities should provide a robust schedule of recreational activities, including movie screenings, musical performances, and social gatherings, to combat feelings of isolation and promote social interaction. Regular group activities and opportunities for social engagement are essential for fostering a sense of community and belonging. Addressing mental health concerns, proactive identification and management of mental health issues, such as depression and anxiety, are vital. Facilities must have established protocols for identifying residents exhibiting symptoms of mental health challenges and ensuring timely access to qualified mental health professionals. Providing consistent encouragement and positive reinforcement, focusing on past achievements and future aspirations, is crucial for maintaining morale and fostering a sense of purpose. A multidisciplinary approach, involving medical professionals, caregivers, and family members, is essential for comprehensive mental health support. 5. Violation of privacy and dignity. A primary concern for the elderly entering nursing homes is the loss of privacy and dignity. This is not merely a matter of personal space but encompasses feelings of autonomy, respect, and self-worth. The erosion of privacy and dignity among the elderly in institutional care settings stems from a confluence of factors. Firstly, the loss of personal space is profoundly impactful. While individuals residing at home enjoy the autonomy of their own private quarters, meticulously arranged to their liking, institutionalized seniors often share rooms, leading to significant inconveniences. This shared living arrangement curtails personal freedom, forcing adaptation to potentially incompatible routines and restricting private interactions, such as receiving guests or making personal phone calls. This lack of personal space creates a stark, impersonal environment, far removed from the comfort and familiarity of a personal home. Secondly, the increased dependence on others significantly contributes to feelings of powerlessness and diminished self-worth. At home, the elderly often maintain a degree of self-sufficiency in basic daily activities. However, in institutional settings, reliance on caregivers for essential tasks such as toileting, bathing, dressing, and eating becomes unavoidable. This dependence fosters feelings of helplessness and a loss of autonomy, undermining their sense of dignity and self-respect. The constant need for assistance in personal care can be deeply humiliating for individuals accustomed to independence. Thirdly, the dehumanizing shift from family member to patient is a critical factor. At home, elderly individuals retain their familial roles and voices, maintaining their status and influence within the family structure. In contrast, institutional settings often treat them primarily as patients requiring care, subject to rigid schedules and institutional regulations. This loss of agency and control over their daily lives contributes to feelings of diminished worth and insignificance. The structured environment, while intended to provide care, can inadvertently strip individuals of their identity and autonomy. Fourthly, a lack of respect from staff or fellow residents further exacerbates the problem. Not all caregivers are empathetic or understanding of the emotional needs of the elderly. Disrespectful behavior, including harsh language or indifference, can be deeply damaging, fostering feelings of being undervalued and disregarded. The use of impersonal terms or numbers instead of names reinforces the sense of being reduced to a mere statistic rather than an individual with a unique history and personality. Finally, the violation of bodily autonomy during personal care is a significant source of shame and indignity. Requiring assistance with intimate tasks such as bathing or toileting can be profoundly embarrassing and humiliating, particularly when provided by strangers. For individuals who have lived independent lives, this loss of control over their bodies can be deeply distressing and contribute to feelings of vulnerability and loss of dignity. The inherent vulnerability of the situation necessitates a heightened level of sensitivity and respect from caregivers. The ramifications of elderly individuals experiencing a loss of privacy and dignity are profound and multifaceted. A diminished sense of self-worth arises when autonomy is eroded. Deprived of the ability to make decisions concerning their own lives, the elderly may perceive themselves as a burden on society, leading to a gradual erosion of self-confidence and a reluctance to express opinions or participate actively. This diminished sense of self can manifest as social withdrawal and a reluctance to engage with others. Furthermore, the experience of being treated as someone without agency significantly increases the risk of depression and a general decline in mental well-being. This psychological distress can precipitate a rapid deterioration in physical health and a loss of the will to live. The resulting decline in overall health can create a vicious cycle, further exacerbating feelings of helplessness and dependence. The erosion of privacy and dignity also negatively impacts familial relationships. Feeling neglected and disrespected, elderly individuals may become withdrawn, irritable, or actively refuse communication with family members. This breakdown in communication creates a widening chasm between generations, intensifying feelings of isolation and loneliness. The resulting estrangement can have devastating consequences for both the elderly individual and their loved ones, hindering the provision of necessary care and support. Addressing these issues requires a proactive and compassionate approach that prioritizes the autonomy, dignity, and well-being of the elderly population. Solutions to preserve the dignity and privacy of the elderly. Enhance the living environment in nursing homes. Prioritize nursing homes offering private rooms or those with low occupancy to ensure privacy. In shared rooms, establish personal spaces for each resident, minimizing intrusion. Respect personal autonomy. Empower residents to choose their activities and make decisions regarding diet and daily routines, rather than imposing standardized rules. Encourage self-sufficiency whenever possible, avoiding excessive assistance. Maintain a respectful approach. Address residents using their names or respectful titles, avoiding generic terms. Always seek consent before assisting with personal care. Treat each individual with dignity, recognizing their inherent worth beyond their age or health status. Foster self-esteem. Encourage participation in activities aligned with their interests, reinforcing a sense of purpose. Facilitate opportunities for sharing experiences, storytelling, or mentoring younger generations, leveraging their valuable knowledge and skills. Maintain family engagement. Regular phone calls, visits, and attentive listening prevent feelings of isolation. Actively inquire about their well-being and willingness to make changes, facilitating improvements in their quality of life. 6. Challenges associated with departure. Leaving a nursing home is a complex process, even when the elderly individual desires to return to family life or independent living. Numerous obstacles hinder their departure, encompassing financial constraints, health concerns, psychological factors, and the necessity of familial consent. Difficulties in discharge from nursing homes, a multifaceted problem. Several factors contribute to the challenges faced when elderly residents seek discharge from nursing homes. Firstly, declining health and diminished self-sufficiency are significant barriers. Prolonged institutionalization often results in a loss of independent living skills, rendering residents reliant on staff for basic needs such as bathing, eating, ambulation, medication management, and chronic disease control. Consequently, even if they desire discharge, their physical condition may preclude independent living. Secondly, family unwillingness or inability to provide care presents a major obstacle. Families may be accustomed to the absence of the elderly parent and lack the willingness or capacity to alter their lifestyles to accommodate their care. Common deterrents include time constraints due to work commitments, lack of suitable living space, and concerns about the financial burden of hiring caregivers or covering medical expenses. This rejection can be profoundly disheartening for the resident. Thirdly, financial constraints often prohibit discharge. Living expenses outside a nursing home can exceed institutional costs. Without sufficient retirement income or other financial resources, discharge becomes infeasible. The need for in-home care or specialized medical treatment further exacerbates financial burdens. Prior sale of assets to fund nursing home placement may also eliminate alternative housing options. Fourthly, established routines and dependencies within the nursing home environment create significant challenges. Residents become accustomed to structured schedules, readily available meals, on-demand assistance, and a regulated lifestyle requiring minimal personal responsibility. The transition to independent living necessitates managing these aspects independently, potentially causing stress and anxiety. Finally, fear of change and the psychological comfort of the familiar environment often deter residents from leaving. Concerns about loneliness, social isolation, and the inability to adapt to life outside the nursing home are common. For some, the nursing home has become their home, eliminating any desire for relocation. The ramifications of involuntary confinement in nursing homes are significant and multifaceted, impacting the residents' psychological and physical well-being, as well as their relationships with family members. The inability to leave, despite a desire to do so, fundamentally undermines an individual's autonomy and sense of control. This enforced confinement can lead to feelings of profound helplessness and hopelessness, manifesting as depression, apathy, and a general lack of motivation. The resulting emotional distress can be severe, potentially exacerbating existing health conditions and accelerating cognitive decline. Furthermore, the perceived abandonment by family members, a common consequence of prolonged institutionalization, can severely strain familial relationships. The frustration and resentment stemming from this perceived neglect often translate into interpersonal conflict. Residents may become increasingly irritable, exhibiting anger and hostility towards loved ones, creating a cycle of negativity that further isolates them and damages already fragile bonds. This breakdown in communication and emotional connection can have devastating long-term consequences for both the resident and their family. The detrimental effects on physical health are equally pronounced. The loss of hope and the pervasive sense of confinement can lead to a decline in self-care practices. Residents may experience decreased appetite, reduced physical activity, and a refusal to participate in rehabilitative or social activities. This passive resignation contributes to a rapid deterioration in physical health, accelerating the aging process and increasing the risk of secondary health complications. In essence, the inability to leave a nursing home represents a significant threat to the overall well-being of elderly residents, impacting their mental and physical health, and irrevocably damaging their relationships with family. Facilitating a senior's discharge from a nursing home, a structured approach. A comprehensive discharge plan is essential. This plan must clearly define the senior's living arrangements, caregiving responsibilities, and financial provisions. Thorough preparation regarding finances, housing, and healthcare is crucial to mitigate potential risks. The home environment must be adapted to the senior's needs. This includes ensuring proximity of bedroom and bathroom, eliminating stairways, and installing emergency assistance systems. In-home support services should be arranged as needed. Pre-discharge medical consultation is mandatory. A physician's assessment is necessary to determine the senior's suitability for discharge and to identify any required ongoing medical or rehabilitative care. Home health care services should be considered as an alternative to immediate discharge if necessary. Active family engagement is paramount. Consistent communication, demonstrating support and involvement in the discharge planning process, will significantly enhance the senior's confidence and willingness to transition. In retrospect, I wish I had known these things sooner. Nursing homes are not the idyllic havens I once imagined, nor are they unequivocally nightmarish. Understanding these realities beforehand is paramount. What are your thoughts? Have you or a loved one experienced similar situations? Share your experiences in the comments section. I am eager to hear your stories. If you found this video informative, please like and subscribe to explore further valuable life lessons. Until next time.